It is. They're very, very fun.
And how do you make sure you absolutely need this?
It'll tell you. Watch.
This is a training
First thing you always do is turn it on.
will be delivered.
So I've got my AED has just shown up.
Remove clothing from person's chest.
Always want your patients naked if you can. So you've removed the clothes.
Firmly to person's chest, as shown.
Pads show you exactly where they need to go. Underneath the collarbone on the right side.
Plug-in connector.
And just underneath the last rib on the left side. Your heart's going to be sitting basically right here. So you got a pad here, a pad here, so that electricity is going to go right through it. So you always want to put these pads on upper right, lower left. You hear what it's saying to me?
I'm sorry, what's listening to you?
Check connector and pads.
Check connector and pads.
Is it doing anything else? I'm not doing what it's telling me to do.
Tell you to plug in.
Yep.
Check connector.
It's also flashing where I need to. I've got this little piece.
These things off that you're looking at?
Yep. So now I'm going to plug this in. Now that I've done what it's told me to do, it'll go on.
Stand clear.
It's analyzing this rhythm. It's seeing if the heart's shaking like a bowl full of jelly, if the heart is completely dead, or if it's beating normally. It's determined that I need to shock. I need to make sure from head
Everyone
to
stand
foot,
clear.
nobody is touching this person. It's flashing a light where I need to push to shock. I don't want to just be staring at my machine and hit shock. If you're touching his foot, I've just killed you. So I'm clear, you're clear, everybody's clear.
Push the shock button.
I'm shocking.
Shock delivered.
I hit the shock button
Cycles of CPR.
and it tells you to start doing CPR. These machines, while they have different voices and they may look a little bit different, they all do the same thing. When I hit that shock button, he's just going to twitch about like that. And it's not like the movies. They don't come up off the bed, unfortunately. It takes a lot of the fun out of it. Plus, you don't get to do this anymore. These things will stick on the chest pretty well.
Can we just go right over those pads and start
Yep.
our compressions, right?
1 minute
Yes.
and 30
And
seconds of CPR
It
remaining.
counts down for you.
I should have asked him, not you.
Yeah. So what you're going to do, I'll pull these off here real quick.
Do we take them off when we start doing CPR again, or we leave them on?
Nope, you'll never take these off. In fact, EMS may take your machine with you, or with them, yeah. Because they can, some of these machines, they can tell how you did your CPR, what the rhythm was, why they shocked. These machines will store a lot of information. You shut them off, you could erase the memory.
1 minute of
So they may take it with them, keep it active, and then they'll pull it out. And then they'll just get it back to you. Would you be so kind as to arrive with that? I'm doing my CPR. And then you show up with your AED.
Do you want me unconnected?
plug-in
Yeah.
connector.
Actually hit that green button too. Okay. So you've just shown up and I'm doing CPR.
Call 911, here's the
Okay. You're in charge. So set that thing down. While I'm doing this, take those pads.
Training device only. No shock will be delivered.
And then go ahead and open those pads and you're going to start putting those on.
Clothing from person's
I've already
chest.
got my patient's clothes removed. So as I'm doing this,
Attach pads firmly to person's chest as shown.
oh, you can plug it in now.
Plug-in connector. Analyzing rhythm.
Now I need to stand
Everyone
clear
stand clear.
because it's analyzing, so you have to stop touching it at this point. So as you can see there, I can do
Shock
CPR
advised.
up until
Everyone
these pads come
stand
on.
Clear.
I could even be doing some compressions right now while it was
Everyone stand clear.
charging
Push
up.
the shock button.
Until he pushes the button.
Yep, and then you're clearing everybody and you hit that shock button.
Shock delivered. Begin 5 cycles of CPR.
And then I go right back into my CPR. So you don't have to stop doing CPR when you're putting the AED on. You can just keep going. First thing you always want to do, turn it on and listen to what it tells you to do. There are some models now that are completely automated because some people are a little afraid to shock And so they will actually do the shock as well as everything else.
So when it gives a clear warning, it's like you best get back.
Yeah, I wouldn't want one of those automated ones
30 seconds of
because the machine
CPR
can't tell if
remaining.
anybody's touching it or not.
Right.
So that would scare me just a little bit.
Plus, if you got that bad boy out, it's like pushing the buttons. It doesn't matter.
Exactly. Yeah. Some people don't feel that way. Some people feel that they're going to kill them.
How many times might you be expected to use this, the shocker in it?
It could keep
It'll
going.
just cycle until the warranty show up there.
Yep. Even if your heart, say your heart's doing that bowl full of jelly thing, why don't you take a look at that and then pass it down? But if your heart is shaking like a bowl of jelly and you shock it and the heart goes from this and just stops, comes back and it's going like this, it's going to need to be shocked again. You shock it again because it's shaking like this, and this time you stop it, but it just doesn't start again. So the next time that machine analyzes, it's going to tell you no shock advised. Its job is to stop the heart. It did its job. It's not going to shock if the heart is not beating. If the heart's beating normally, it's going to know that, and it's not going to shock. You won't accidentally shock anybody. That's not the way this is designed. What is more likely to happen is you're going to not shock somebody who needs it because you're not thinking and you have your hand on that pad. You got heartbeats in each one of your digits. Your hand sitting on there, that machine may pick up your rhythm instead of the screwed up rhythm and not shock. So that's where you're going to have an issue. But it's not going to interpret a rhythm and shock accidentally. They're very well calibrated. They know what they're doing. Yeah.
Is there a case where somebody's heart rhythm is really messed up, but they're still conscious?
Mm-hmm.
Can they then object to being shocked?
They can't. They won't be shocked if they're conscious and they have two particular heart rhythms. Then they won't be able to object because that's a cardiac arrest situation. There are situations where they could have a weird rhythm that would need to be shocked where they would be awake. Well, yeah, they could sign for that, but that'd be an EMS thing that they would do. It's called cardioversion, and they shock them while they're awake, but typically they'll numb them up a little bit, not all the time. And hopefully that shock, it's a less powerful shock, but hopefully it'll knock the heart into the right rhythm. It's not something you'd have to worry about though.
As long as you're doing the, sorry.
What kinds of burns will be on the chest after applying the AED?
Shouldn't be.
They used to teach that you'd use like the extra pads in the kit to rip like chest hair off
Yep.
because you still do that because it would catch fire.
It won't. It may catch fire,
Yeah.
probably not, but more than anything, it's not going to stick as well,
Okay.
so the energy won't go as well.
Okay.
And what was
As
yours?
long as you're doing the compressions on the chest, like, does that supply enough blood to the brain and stuff to keep you from going brain dead or what?
It should. It should. It's
I mean,
12 to
typically it
20% survival rate if you do perfect CPR, and nobody does perfect CPR. It's a stopgap measure, but most people who die, there's a reason that they have died. It is very difficult to get them back.